So what is the most pressing issue for parents when it comes to their children today? The new study finds it's drug use and mental health. The study by Lurie Children's Hospital and the Chicago Department of Public Health reveals these were already leading concerns before COVID, but the pandemic just made it worse. Joining me to talk about this now is Dr. Matthew Davis with Lurie Children's and Northwestern University's Feinberg School of Medicine. Good morning to you, Doctor. Good to see you.
Good morning, Sylvia.
I want to start with the concerns because any parent has to be concerned about this. But before we get into any of the specifics, what is it about the pandemic that has worsened the situation for our children?
There are at least three major factors that the pandemic has made worse for kids. Number one, many children have experienced the serious illness and in some cases the passing of a close family member or friend related to COVID-19. This could be a parent or grandparent, an auntie or an uncle, or a family friend. Number two, their regular routines before the pandemic, going to school, having the routine at home, have been completely disrupted in most households because of the stay-at-home orders last year and the virtual learning platforms that many schools were following. And number three, even as we've gotten more members of our Chicago communities vaccinated, we still have the risk of COVID-19, as we know, and that's leading to persistent adjustments that need to happen at schools in order to keep kids and teachers and staff safe.
Which is probably continuing the anxiety. So let's take a look at the top-ranked youth health concerns that were identified by adults in the study that you guys took. As we look, drugs, 65%, tobacco, e-cigarettes, 65%, stress, 62%, depression, 62%, child abuse and neglect, 60%, suicide, 57%, childhood obesity, 57%, and teen pregnancy, 49%, alcohol, 46%, unintentional injuries, 39%. Tell me what stood out about these when you guys took this survey.
We were really struck by a couple things, Sylvia. One is that even before the pandemic, members of the Chicago community, not only parents, but adults and other households as well, recognized the challenges of mental and behavioral health for our youth in our city. Those have continued to be very high levels of concern during the pandemic, and as we just talked about, with good reason. We know that children are really faced with a lot of challenges with regard to their mental and behavioral wellness today. Number two, although we tend to think about the challenges of youth health regarding physical challenges such as obesity, for example, or injuries, it's clear that the public understands there's a very strong need to focus on mental and behavioral health as well.
Yeah, now that we've confirmed this, as you said, we knew it before, it's gotten worse. What do we do about it? What do you want parents at home who are watching this, what do you want them to know about the role they can play and the role the schools should play?
Great question, Sylvia, because it's all about the practical day-to-day support that we can provide to our kids, whether they're children or teenagers. Number one, we need to let our children know that they are loved and supported. That is a critical message for all of our youth, especially with still a lot of uncertainty related to the pandemic. Number two, there are resources beginning with primary care clinicians in our neighborhoods, whether they are pediatricians, nurse practitioners, family physicians, members of the medical community are here to help. Number three, there are many resources available for parents who are wondering about what messages to share with their kids. There are many helplines regarding suicide prevention, tobacco use, alcohol problems in the home, etc. And I encourage parents and those taking care of children beyond the parents to make sure they tap into those resources for suggestions as well.
Well, we have a list of some of those resources. So while you and I are talking, we're going to put some of them up right now. What do you want to say to parents who've never reached out to these helplines before about what's involved and what difference it can make in giving them the support that they might need?
Sylvia, thanks to you and your team for sharing these numbers here. What I would say as a pediatrician to parents and grandparents and folks who are caring for our youth today is that these lifelines, these helplines, are here to help us with concrete suggestions. Yes, they will say, this is hard, you're not alone, and they will also provide concrete suggestions about how to take the next step towards a healthier future for the children and adolescents in your household.
Doctor, thank you so much for joining us and sharing this report. It's so important. A lot of times parents find themselves in these situations and they don't know what to do. And it's good to know that it's being recognized, that there are issues and there is help for everyone. So we appreciate your time this morning. Thank you again.
Pleased to be with you, Sylvia. Thank you.